in Victoria, with the only dedicated youth access point front yard and youth community housing provider, MCM Housing. And I would like to begin by acknowledging that I'm joining from the sovereign custodial lands of the Wurundjeri people and pay my deepest respects to their elders past and present and all ancestors. And I extend that acknowledgement to the creation spirit, Bunjil and Wa and Burrung, the water life force that runs through the Kulin Nation. I pay my respects to all Aboriginal and Torres Strait Island peoples and country joining today, acknowledging that sovereignty of country was never ceded. And I believe that Viv is also on Wurundjeri country today. So today's session is to connect you with the Home and Mind project and subsequent policy and research report with some key findings and recommendations. And I'll invite Viv now to introduce herself and provide some background to this important work. Thanks, Viv.
Terrific. Thank you so much, Douschka. I just wanted to make sure that people can see the slides that I'm sharing. Douschka, I can see you on the screen. Can you see the slides?
I'm just having a look. No, I can. You're all good, Viv. Thumbs up. Thumbs up.
Thank you. And now I just need to get them to change through. Great. So yes, I'm also joining from Wurundjeri land, as Douschka said, so acknowledging traditional custodians, past and present and emerging. In 2023, Orygen and Melbourne City Mission connected around a shared advocacy objective, and that objective was to ensure that young people that were experiencing homelessness and mental ill health were not left out of the system and service reforms that were underway in Victoria at that time. Those system reforms are being driven by the implementation of Victoria's Royal Commission into its mental health system. A number of those recommendations and the reforms that were outlined by the Royal Commission paved the way for some really significant changes and improvements to the delivery of youth mental health care. And so, as I said, we really wanted to make sure that those improvements were experienced by all young people in our community, and particularly the young people who are most vulnerable and most likely to be missing out on care and supports at the moment. It was driven, Orygen had written a policy report a couple of years prior to this on youth homelessness and mental health, which highlighted what will come as no surprise to anyone in this call, a really strong intersection between mental ill health and homelessness. That report also uncovered and highlighted previous research which showed there was significant barriers for this group of young people to access mental health care and support. And that when they did access mental health care and support, that their experiences were ones of often heightened stigmatisation or additional barriers to actually get extended long-term care that they needed. And from Mission Australia's Melbourne City Mission's point of view, they've sort of saw firsthand every day the mental health consequences of homelessness and how the youth mental health system hadn't been designed to support the young people that they saw that were without families. They saw their young people cycling between emergency departments and refuges as a result of not getting the support they needed for their more serious and complex mental health issues in the community. So the reform agenda in Victoria provided a really great opportunity to make sure that the system was redesigned in a way that supported this very vulnerable group of young people, and we didn't want to miss that chance. We also realised that anything that we could do together as two services across two different sectors would be more impactful than if we advocated separately. And we also thought it would send a really strong message to government as well that the mental health sector and the housing and homelessness sectors were really committed to working together to not only confront head-on what some of the challenges were at the moment, but also to identify and present to government some really strong solutions on how we can develop a purpose-built youth mental health and wellbeing response for young people who are unaccompanied and trying to get mental health care. Joining in this project was also the two key peak bodies in Victoria, the Council for Homeless Persons and also Mental Health Victoria, who provided leadership within a project reference group. And the most important partners in this work were young people with a lived experience of mental ill health and homelessness. Douschka's going to talk more about that as we go on about the role of the Lived Experience Advisory Group. But I just wanted to say it was one of the truest demonstrations of lived experience co-design that I've actually seen in projects that I've been working on for many years. And so together we've produced this policy research report, which we'll talk through the findings for, that highlighted the need for a number of things. It highlighted the need to first and foremost address housing insecurity, and that was a fundamental driver of mental ill health for young people. It identified the need to alleviate the systemic and structural barriers that were impeding young people's access to mental health supports, to improve our understanding of the stigma and discrimination and harmful practices that were actually occurring within the health system and mental health system for these young people when they did present for care, and then investigate what kind of integrated multidisciplinary support models could be provided to young people that could make a tangible difference to their experiences both of homelessness and mental ill health. So more about that later. Just very quickly, we looked at some statistics. Again, none of these are going to be particularly surprising. Across the country, I mean, for this project, we were mainly looking at Victorian data, but for the purposes of this presentation, just taking it up to a national level, where we have almost 40,000 young people who are presenting alone for supports, and around 50% of those are experiencing mental ill health or substance use issues. I actually think that's a significant estimation as well. I think it's probably far higher than that as well, and probably more reflects the fact that many of these young people presenting for housing supports haven't actually been able to get an assessment or a diagnosis for mental ill health as well. From the Melbourne City Mission Victorian Youth Homelessness Snapshot data, we saw 1 in 2 of the MCM clients reporting self-harm, suicidal ideation, or attempting to take their own life. And tragically, in 2023-24 in Australia, every 4 days a young person is dying in homelessness. Many of these will have mental health issues that could have been supported through early intervention. And we have a quote there as well from a young person from lived experience saying that their mental health was getting worse, but they had to find a bed every day. So they had to let it slip until they became really unwell, ended up in a psych ward for a little bit, and discharged, and then started all over again. So it's talking a lot to the cycle that we continue to hear about. So I'll hand over to Douschka, who is going to talk through the approach to the report. Douschka.
Thanks, Viv. So the Home project and subsequent report, as Viv referenced, from the initial consultation, decision-making to content and design, was a co-design process that was led by young people with diverse identities who have a lived and living experience of homelessness and mental ill health. The Lived Experience Advisory Group was formed at the initial stages of the project, and was also represented in the project reference group. And it was really important to the Lived Experience Advisory Group that the report not only be informed by lived experience, but be understood and accessible to other young people with those lived experiences. As Viv referenced, it's a well-documented and widely acknowledged gap in mental health support for young people experiencing homelessness across youth homelessness, mental health and health sectors. And initially, when we tested the pre-existing literature with the Lived Experience Advisory Group, we found the onus to receive support and care was often placed on the young person to meet place-based appointments, to meet service access and support criteria, and all while trying to seek a safe place to stay every day. So the Home and Mind project consultation brought together voices across the Victorian homelessness, housing, mental health and healthcare workforces with departmental and commission bodies, including those in mental health, housing, hospitals and broader public health networks. We conducted a multi-sector survey with 132 responses from practitioners working across the support landscape. To bring it into focus here, 94% of young people engaged with those practitioners that responded were at the time or previously experiencing alcohol and other drug support. And it highlights that complexity in the relationship with social determinants and mental health equity. As part of the Home and Mind project consultation process, a dedicated homeless and mental health sector forum was held in partnership, hosted by Orygen. The forum featured guest speaker Dr. Jo Henderson, who's a leader in Canada's integrated youth services model and a key figure behind the development of now, I think, 32 or 33 youth wellness hubs across Ontario. And many of these integrate mental health support with supported housing solution and other supports for young people. So we conducted intensive interviews which captured narratives from the retelling of experiences by young people throughout the Home and Mind report. And I will always acknowledge their generosity and courage in sharing those experiences with me. Home and Mind had commitment referenced, as Viv said, across the executive leadership from both MCM and Orygen, and also the Victorian Homelessness and Mental Health peaks, with a strong core of lived and living experience expertise throughout. So I'll move to some of the key findings now. There was obviously a raft that we found throughout. So what we found broadly was that the existing mental health service frameworks are currently failing to meet the complex and urgent needs of this priority group of young people. Predominantly young people experiencing homelessness with complex mental health support needs are also the young people disproportionately impacted by structural inequality. Significantly high percentages of young people who are First Nations, part of the LGBTQI plus communities, those with disabilities or diversely abled, ethno-racial young people, and those using substances and alcohol. First and foremost, there is a fundamental lack of housing available for this group, and recovery from trauma and addressing mental health needs cannot begin without the most basic human requirement, and that's a safe and stable place to call home. So without those integrated supporting housing and mental health responses, young people are often forced into this impossible choice between prioritising their mental health support needs or securing shelter. The report identified a range of structural barriers that hinder young people's access to mental health support, spanning the entire continuum from headspace services to broader community and public health systems, including access. Sorry, I lost my train. Where am I? I'm sorry, I'm reading my notes. So, including access impacted by geography, income, and administrative burdens. And we found that while the practice principle of not discharging individuals from mental health care into homelessness is vital, it created an unintended barrier to admission for young people seeking emergency inpatient care or bed-based recovery services. So we found in the absence of accessible mental health services that there is a growing over-reliance on crisis and emergency responses, and particularly hospital emergency departments. Young people are provided with limited mental health support and too often discharged directly back into homelessness access points. At MCM's front yard access point, we see children as young as 15, 16 navigating these systems alone, who are caught in this revolving door between homelessness services and hospital emergency departments. And as the lived experience advisors stressed, 000 and hospital ED shouldn't be at the top of a young person's mental health care plan. Young people shared experiences of structural discrimination while presenting to EDs seeking mental health support. Once they were identified as experiencing homelessness, there was often an assumption that a young person was there seeking a bed, diminishing their need for mental health support, which resulted in them often leaving without adequate assessment or treatment. And sadly, young people reported high incidences of suicide attempts following unsuccessful efforts to receive mental health support from hospitals. Young people reported similar discrimination associated with their substance and alcohol use, which was identified often in the context of them managing the lack of mental health support, isolation, loneliness, and the trauma of extended periods of homelessness, with the complex experiences underpinning that homelessness journey. The Home and Mind report identified pockets of promising models that showed the viability and impact of integrated service delivery for young people at the intersection of homelessness and mental health systems of care. And these programs featured multidisciplinary teams, including homelessness practitioners, mental health clinicians, and peer support workers who engage young people in community settings and not just at service sites. And this relational outreach-based approach significantly reduced their risk of isolation, disconnection, and further harm. So I'll hand over to Viv now to speak about some of the key Home and Mind recommendations, including investment into new and existing care provision for these young people. Thanks, Viv.
Great. Thanks so much, Douschka. And just on that last point too, in terms of scaling successful integrated programs, as Douschka mentioned earlier, one of the components of this project was a sector forum where we heard from Dr. Jo Robinson from Canada, who talked to some of the integrated youth service models that they had developed over there. We have very similar approaches here, and they've actually, the Canadian approach, learnt from models like Headspace in Australia. What they talked about, though, when they came to speak to us, was a number of the models that had deliberately thought through and had housing and homelessness as a sort of a key component of the service that was being provided to those young people. And so by that we mean support for basic needs, some services actually having accommodation provided within the integrated youth service, even if short term, strong local consortium models that brought together the relevant agencies to provide that holistic care. These services were often peer-led at the front end, so the focus was on building that relationship with a young person, particularly young people that had had traumatising and or stigmatising experiences of systems and health systems in the past, being able to connect with someone first up, who was a peer, who had similar experiences with them, and create that sense of trust and relational security was key. For those sorts of models. We heard from our Lived Experience Advisory Group and other young people who engaged in this project that there was really strong support for this type of integrated service approach that was non-clinical, in the first instance, peer-led, purpose-built responses for young people experiencing homelessness. Once established with that relationship, the links being made into clinical services are obviously critical. To have in reach when a young person was most comfortable and ready to commence mental health assessments, care and treatment. So just wanted to talk a little bit to that model, and they're worth having a look at in Canada. So not surprisingly, those models were ones that we recommended going forward, but just in the first instance, I suppose the kind of key recommendation, and again, the real crux of this report and the recommendations were that without safe and secure housing, young people would continue to experience poor mental health, because the experience of that housing insecurity and not knowing where you're going to sleep that night and whether you're going to be safe is not conducive in any way, shape or form to good wellbeing. And so the Royal Commission into Victoria's mental health system, for those of you not in Victoria, had a recommendation for 500 supported accommodation places for young people who are experiencing mental ill health and homelessness. So that supported accommodation was over a longer term and obviously included wraparound range of other supports, but very much embedded mental health care within the accommodation arrangement. That was recommended in 2020, and so in 2025, while we've had some work done towards describing what that model would look like, there's not been a cent budgeted yet for the actual implementation and getting those accommodation places up and on and available for young people. So this report called for urgent action to get going on that recommendation, because we feel like it's the one that would have the most impact. For the second one, as we discussed before, the project demonstrated that there's really great outcomes when agencies are working together. We've seen that there's lots of places where that occurs already around Australia, at local levels, regional levels, and even at a state level. So it's certainly endorsing that work going forward, but I suppose recommendation from our end to government is the fact that they need to resource the engagement in those networks. So there's often an expectation for services just to find time and amongst everything else that they're doing and supporting young people in crisis, to then also find time to engage in those networks. So they do require FTE, they do require resourcing and validation within service models as well. So it was a shout out, I suppose, to include that in any future models of care and make sure it was well resourced. Unfortunately, one of the things that the report has also identified is the high risk of suicide and suicide-related behaviours among young people who are experiencing homelessness. That's been a pathway, unfortunately, for many young people, entirely preventable, completely unacceptable. And so the report also called for the Victorian Coroner's Office to conduct a cluster case review to identify where clinical care interactions for homeless young people had existed, or where there were opportunities that policies, systems and service responses could be improved to enable access to care and potentially prevent those suicides. So that was a strong recommendation from this report at a Victorian level. Similarly, we also heard from young people, as Douschka has mentioned, that there's sometimes quite damaging and stigmatising responses when they do present, in many cases, to emergency departments. As we said, that's often been the point of last resort for young people when they're in a state of mental health or distress crisis. What we found with this report, we had to talk to young people one-on-one to really unpack and identify what those experiences were. They're a group of young people who don't necessarily have the means all the time, particularly when they're looking for where they're going to sleep the next night, to then engage in complaints processes of how they've experienced care when they have sorted out. So the report called for the Mental Health and Wellbeing Commission in Victoria to actually take that on and assertively undertake an inquiry into the responses to young people in emergency departments when they're presenting in mental health crisis, and again provide some recommendations for policy, procedure, training and new service responses to prevent that happening in the future. And then finally, because no one with mental ill health should have to resort to an emergency department for care, that's obviously not an ideal situation for anyone, and particularly not this group. We recommended that there was a need for more community-based early intervention supports that specifically responded to the experiences and needs of young people experiencing homelessness. So similar to the Canadian models that I described before, we believe that these services could be largely peer work led at the front end, focus on developing trust, relationships, meeting basic needs, including on-site refuge triage as well, so they're not worrying about where they need to sleep that night, and then provide that hub for clinical services to in-reach to when required. As I said, young people with a lived experience really strongly endorsed this model, and we believe that with further investments in youth mental health care that's coming down the line from the Australian government in the next few years, there's a really great opportunity to incorporate some of these elements into the models.
Absolutely.
And back to you, Douschka.
Thanks, Vivienne. I think we're looking pretty good with our session timing. Everybody, please feel free to copy the QR code for the report or Google, and there are contact details in the report for anyone who is part of this work or whose work aligns and wants to reach out. It will be great to connect with you.